Hello everyone and welcome to our virtual educational program. In this module, we will be discussing occupational therapy and the role that occupational therapy has in working with caregivers. Before we dive into what occupational therapy is and the benefits of occupational therapy for caregivers, it is important to understand what the word occupation entails. Your life is made of occupations, which are meaningful, everyday activities. These occupations can include many roles, such as being a parent, a friend, a spouse, a lawyer, or a caregiver. Everyone has occupations, from the toddler who has occupations of play and learning motor or communication skills, to older adults, whose occupations may include socializing with friends and family or managing their home. We generally do not think of our daily occupations until we are unable to engage in them as we want to, or until we have trouble doing them. In fact, if you are recovering from an injury or you are living with a long-term condition, your valued and meaningful occupations may be disrupted. So what do occupational therapists do? Occupational therapy incorporates your valued and meaningful occupations into rehabilitation, such that you can learn to re-engage in them or modify them based on your current level of ability. Occupational therapists can work in a variety of settings, including hospitals, schools, clinics, skilled nursing facilities, and even in the community. So how can occupational therapy help with caregiving? First, let's define caregiving. Caregiving is a co-occupation that requires active participation by both the caregiver and the recipient of care. It includes providing care for others, whether it being formal care by paid caregivers or informal care by family or friend. Occupational therapy practitioners have the skills to appreciate the concerns surrounding the complex role of caregiving. In fact, occupational therapists utilize a holistic approach when working with their clients. This approach includes all dimensions of well-being: physical, strength, flexibility, endurance. Your physical well-being helps prevent disease, adds quality of life and length of life. Caregivers may experience changes in sleep patterns and physical sickness, like viruses or colds. They may also experience exhaustion, changes in appetite, headaches, or digestive issues. Intellectual, engaging in creative and stimulating activities that maintain and increase the function and capacity of your brain. An intellectual wellness impact includes difficulty concentrating, completing tasks, or hesitating to try new things. Environmental, sense of safety, comfort, and connection with our physical surroundings. When caregivers are experiencing decreased well-being in this area, their home may show decreased organization and cleanliness. Vocational, using your gifts, talents, and experiences to produce income or provide a service. The impact of vocational wellness may be manifested as decreased performance at work, problems interacting with coworkers, reduced job satisfaction, and overall financial instability. Social, fostering personal connections and nurturing relationships with others. Caregivers may experience withdrawal from family and friends. However, community and social support is essential for caregivers. Emotional, overall positive state of being that includes satisfaction, meaning, and purpose. Caregivers whose emotional well-being is impacted by their role may experience the following symptoms: headaches, sleep disturbances, heart disease, anxiety, poor medication management, digestive issues, irritability, or muscle pain. Spiritual, a connection to a set of core beliefs and values that provide you with structure, boundaries, and peace. Caregivers may experience decreased faith if their spiritual well-being is impacted. Additionally, they may lose touch with who they are and the things they enjoy. Many caregivers report that some or all of these 7 areas of well-being are impacted due to the overwhelming responsibilities that come with their role as caregivers. Because of this, caregivers may experience burnout. Although this feeling is often unavoidable due to the demands of caregiving, occupational therapy can guide you in changing behaviors in each dimension of well-being, which can lead to improved outcomes. But what is burnout? Burnout is a state of physical, emotional, and mental exhaustion. It affects participation in everyday activities. Burnout is considered a cycle, and it is the job of occupational therapists to give caregivers the tools and resources to disrupt, slow down, or pause the cycle. In fact, research suggests that occupational therapy for caregivers can help in decreasing behavioral symptoms, decreasing psychological symptoms, and decreasing caregivers' report of distress or anger towards their loved one's behavior. Part of the role of occupational therapy is to provide caregivers with education, training of skills, and resources to help meet their unmet needs. This virtual educational and skill training program has been created to fill this gap for caregivers affiliated with Supportive Living Incorporation. We welcome you to explore our videos and resources, and contact us with any questions. Thank you for your attention during this presentation. We hope the information provided was helpful to you.